we're joined today by Sean Petty. Sean Petty is a pediatric emergency room nurse at a public hospital in the Bronx, where he's worked for 14 years, and he's currently the president of his hospital local bargaining unit as a member of the New York State Nurses Association. Sean, thanks for joining us today.
Thanks for having me, Ariella.
So I've asked you here to kind of fill us in with your perspective as an organizer, an advocate for nurses, and as a worker on how the pandemic response on the federal and state level impacted you and how it's changed, or if it's changed during the Biden administration.
Sure. Well, I mean, I think, as most of us can imagine, hospital care has been fundamentally altered and transformed by the pandemic and really pushed to the brink. I would say that, going from the first wave where, New York City, where I work, was hit in the most profound way that a hospital system can be, that up through this recent wave of Omicron, that we have now had 2 years where there have just been numerous system failures after system failures, and there's no plausible deniability anymore. So you could say that, okay, yeah, we underfunded, our public health system and our health. We don't really have a healthcare infrastructure in this country, and we were unprepared by the pandemic. We couldn't have foreseen this. And, we, all of this scrambling that, we did in the first few months of the pandemic to make sure that we didn't run out of hospital beds, that we didn't, and scrambling around PPE, like that was just unforeseen. And now, now we know, and we've, fixed everything, but of course that's just not the case. We're 2 years into this. The Omicron wave has pressed nurses in particular and frontline healthcare workers in general to absolute breaking point. We are facing unprecedented exiting of nurses from full-time jobs and from the profession. Generally speaking, we have unprecedented turnover in our hospitals.
It may seem obvious, but can you talk about why people are leaving these jobs? What is the day-to-day condition like that would make them leave that career?
Sure. I mean, well, so first you've had people that have gone through the unbelievable trauma of caring for people during the pandemic, putting their own health at risk without PPE, without basic respirators and N95 masks. At the beginning, we were told to use one N95 mask for an entire week. So people not only were going and facing the anxiety and threat to themselves and their families, people lost close family members. We lost coworkers. My hospital lost the first public hospital nurse to die in the pandemic in New York City. We lost coworkers, we lost family members. People got their family members sick because of their exposure at work, and those people died. So people faced massive trauma, and not to mention just seeing unbelievable amounts of patient death, especially if you were in critical care, if you're in the emergency room, if you're in the ICUs. So you had that, and then especially if you were an ER nurse, you barely had time to recover. You had a brief break after the first wave, but then you had following waves. You had the return of quote unquote normal, things that we had to take care of, traumas, gunshot wounds, we're a trauma center. So you didn't really get any reprieve. And so you went from the Omicron crisis, or from the first wave crisis, to a staffing crisis that had already existed, but was even more profound. And so you're being worked unbelievably hard every single day in incredibly chaotic circumstances. And even the most seasoned, the most emotionally resourceful, the toughest nurses, still reach their breaking point. And then
Yeah.
that was just combined with this new kind of weird cycle that we're in, where they had to staff all these different waves across the country with agency nurses. So people
Hmm.
could get an agency job, go travel to another place, make 3 to 4 times the amount that you would in your regular full-time job. So there's a massive incentive for people to leave their regular jobs for these agency jobs. So people left to do that. And then that just worsened the staffing conditions that we had. So it just created more chaos, more people left. And then the Omicron wave was just the straw that broke many of our nurses' backs in terms of how much they could handle.
Hmm. We've heard that the Omicron wave was milder. It does seem like it's not as fatal, but it has infected so many more people that there are, similar, if not more, fatalities to the Delta wave.
Right.
Did you see this in your working life? Did you feel like the narrative that it was more mild undermined nurses and medical staff's ability to push for workplace safety measures, for adequate staffing and other workers' rights?
Yeah, 100%. And I think that's actually been the biggest change under the Biden sort of era of dealing with this pandemic, was that um, we're essentially being um, gaslighted entirety as a healthcare system. You know, we it's basically been like this when the narrative shifted to this is a pandemic of the unvaccinated. Uh,
Hmm.
this is a pandemic that is mild, and everybody's going to be fine unless unless you're one of the people who refuse to get vaccinated. It just has never been true. And then Omicron, because it evaded the vaccine in terms of its infectiousness, um, just uh, actually punctured that
Hmm.
mythology. And yeah, of course it was milder. Of course we didn't see the amount of death that we did in the first wave, but the sheer scale of the volume of ill patients. And I do think it's important for us to know, especially amongst the left, that the unvaccinated population is not just Trump supporting right wingers. It is, and even if that were the case, there's problems with how people have approached unvaccinated people. But the fact that the and where I work in the Bronx, there's plenty of people who are unvaccinated for a whole variety of reasons,
Hmm.
and that it is emblematic of how profoundly unable our healthcare system is to build trust with people, uh,
Hmm.
and how much we're set up to build actually healthcare relationships with people in any meaningful way. And so we have this situation where people the by using the scapegoat of the unvaccinated, the people in control of the decisions around COVID have absolutely made it a question of, you know, you don't have any there's nothing that we have to do more than vaccinations and masking, when actually we have an entire healthcare system to reorganize that hasn't been reorganized.
Yeah.
That's the key task. And so, but it's much more difficult to challenge that narrative. Is easier
Hmm.
that when you were fighting against Trump, when you were fighting against Cuomo, and when you were fighting against all this very widely understood chaos. Whereas now the um, the mythology of normality is the main thing we have to fight, and we're even in some ways where some of what we're saying is more visible,
Hmm.
but what's actually an ongoing crisis has also been sort of minimized in a pretty widespread way, and that's incredibly frustrating.
Yeah, I think it's really, really crucial, the point that you made, that what we essentially got with the narrative around Omicron is that if you are getting this version of the disease, you have failed as an individual. And it plays into a broader neoliberal logic that if you want to succeed, if you want to be healthy, if you want to be safe, the burden of this is on you as an individual. And for those individuals that make the wrong choice, there is no social safety net, there is no deservedness of care. And that dynamic in the abstract has undermined healthcare in the United States for decades.
That's
The
right.
idea that it's up to you to cross the finish line, and if you don't, for whatever reason, it's fine because other people are doing it.
That's right.
That the point that you made, that this narrative about returning to normal and using the unvaccinated as a scapegoat undermines a broader focus on the endemic issues in public health care, I think is critical for the left not to lose sight of. Can you talk about the work that you've had to do organizing around workplace safety with the pandemic, and then more broadly, specifically because I think it undergirds what you've said. We have a nation that puts the burden on individuals, but what you've shown and what other union members have shown is that collectively we can actually face up to these things. Collectively we can actually make some kind of an impact, even though the fight is hard. So what are some of the fights around the collective workplace safety that you've been engaging in lately?
Yeah. So, I mean, there's been two critical fights. I mean, one has been, specifically around Omicron and staffing, and the question of fundamentally transforming our approach to public health. I mean, still, we're in a situation where they staff hospitals in a skeleton crew kind of way, in a very neoliberal, just-in-time model of staffing. They want to match exactly the amount of nurses that they need for a algorithm generated amount of patients that they expect to get, and they don't want to staff anymore. And so if reality doesn't fit their algorithm, then that's just what the nurse has to deal with and the patients have to suffer from in a given time period. And of course, that model is disastrous when you're dealing with the wild unpredictability of pandemic waves. So the Omicron wave, really highlighted that. One of our ER nurses, who is one of my really close collaborators, Kelly Cabrera, in the hospital, relayed a story to me in the last month where she had to take care of 9 admitted in the emergency room, 9 admitted inpatient patients, 6 other emergency room patients, 2 of which were bound for the ICU. 3 of those patients in the ER were in end of life care, were gasping for breath, and she didn't even have time to talk to the doctor to get them pain medication. And then she was, not only did she have those 15 patients that she was assigned, very sick patients. Like, these are not just like, oh, I hurt my toe in an emergency room. These are very sick emergency room patients. And she was pulled to have to go to traumas, to people who were brought in emergently by that were coding, that were in car accidents, etc. And so it was just, she said to me, and this is where I knew things were just in a profound crisis. She said this was worse than any day that I worked in March and April of 2020, when she had that assignment that day. And so, so we were responding to that. We organized an action outside the hospital. We called press. We were, because of our actions through the pandemic, our PPE actions that we organized that were successful in getting attention and helping to inspire other hospitals in New York. The press has sort of an eye towards us. And so we use that leverage to have another event an action at Jacoby, which really just trying to puncture that narrative is really, it was really the goal. And we timed it out. By the time that we called that action, it appears that the hospital immediately moved into action to march in about 60 travel nurses, 40 from local travel agencies and 20 from national travel agencies. And so the day after our action, basically 60 nurses showed up to our door in the emergency room to so that they can make it look like they, that they were already on top of it, and that they were trying to address the crisis. And we've known that but we've known that that's how we've had to get stuff, and throughout this pandemic. Our big question, before, during, and after these kinds of things is, why does it have to take this? Why does it have to take us mobilizing? Why does it have to take us speaking out to get just the ABCs of basic staffing and public safety? So that's our question to, Mayor Adams. That's our question to Governor Hochul, and that's our question to Biden is, how do you fix basic staffing levels, and organize a healthcare system that's centered on care and not cost cutting and profit margins. And they still haven't lifted a finger to restructure the healthcare system in order to do that, even though this pandemic has exposed exactly that's what needs to happen. That was the Omicron organizing that we did. And then recently, we had an active shooter in our emergency room, in our waiting room. We had a patient, a person who signed in as a patient, come in, shoot somebody else in the waiting room, run through the hospital, and exit after running through 3 buildings in the hospital. And nurses had to duck bullets, go grab the patient that was bleeding, that was shot, run them back to the trauma bay, take care of them, all while not knowing if there were other shooters, if this person was going to shoot again, trying to bring patients inside the emergency room for safety, etc. And so that obviously was a major incident. It's been the second shooting in a hospital. There was a shooting in Bronx, Lebanon 6 years ago, but those are the only shootings that I know of in hospitals in the last couple decades in New York City. Sorry. I've spent the last 2 weeks, and my colleagues have spent the last 2 weeks organizing to push the hospital to finally implement safety measures that we've been asking for the last 3 years. We had a safety walkthrough 3 years ago that delineated all of these things that were deficient in terms of protecting workers in the hospital against these types of incidents. And they implemented almost none of the recommendations that we put forward. And we've had weapons be confiscated off of patients, numerous times since then, and the hospital still refused to act. But now that, of course, one of the worst incidents happened, now we're getting finally some action. And on Sunday, when the mayor called a press conference at our hospital to, pat us on the head and talk about, all the important things that he wanted to do around safety and all the successes that he's had during COVID, we staged an action with 10 of us in the back of the press conference with signs, and we interjected in the press conference and compelled him to have a meeting with us directly, with the frontline nurses at Jacoby, which happened this morning. So we're pressing for a range of measures to improve safety, and we're trying to do our best to connect the immediate measures with the measures that are going to make the entire borough safer in the long term, which, to be honest, is, ultimately what we need is a functional mental health care system in Bronx. We need, most of violence is connected in some way to poverty and into psychosis, into people experiencing psychotic breaks. And so we are trying to connect that we want the immediate safety measures put up either temporarily or permanently. They need better procedures. They failed in a number of different ways. The facility failed in a number of ways in responding to this particular incident that we're pushing to redress. Um, but we consider this part of a bigger fight, which is about, again, it's connected in the pandemic, which is just we have a radical lack of anything approaching a healthcare infrastructure that has ongoing connections deep in the community. And
Mm-hmm.
it doesn't take a radical, it doesn't take a fundamental restructuring of our entire lives to make this happen. New Zealand, South Korea all had radically, Costa Rica, Cuba all had radically better pandemic approaches. They also have
Mm-hmm.
radically better community health infrastructure. They have
Mm-hmm.
regional healthcare hubs that have demographically tracked all of the people in their catchment area and know their medical information and know what their health risks are. They know that this place has more hypertension, this place has more diabetes, these people are vaccinated, these people are unvaccinated. Let's have a conversation with it. People have a relationship to these people. These people are decently, paid and live in those communities. And
Mm-hmm.
so, those those types of ABCs of community healthcare just are anathema to the for-profit way that our healthcare system is structured, and we've just got to continue to call the question on that and use those examples as why can't we have that in the richest country in the world, and
Mm-hmm.
and that and highlight the human consequences of not having that. And so those were the um, two sort of major incidents that we were responding to in the last several months. But yeah, it's certainly an ongoing fight.
That is extremely frightening and trying already at a time when there's so much pressure on medical workers. It's really unbelievable that they then have to take up the mantle and be the ones to demand basic safety, respect, and the kinds of workplace rights they deserve. Unfortunately, that's who it comes down to in each of these cases. But just to wrap up, what would you say the left should do to support workers like yourself, other essential workers during this, particularly when you're seeing a lot of staff leaving these positions, when healthcare is becoming more subject to austerity measures, and when governments, local and state and federal, may use this as a kind of Trojan horse for further neoliberalization? How can the left support workers like you in the fights that you're undertaking?
Yeah, I mean, I think there's no magic bullet way, right? But there's obviously some really important things that we, I think, could be a lot more clear on and should be ready to sort of to act on when things happen. I think one is being crystal clear as a left that we need to that we can't just leap to normality around this pandemic. I know everybody in this world wants this pandemic to be over, but we can't just pretend like that is something that's that's on the cusp of happening. We need to understand that there is imminent threats. We need to continue to push for the ABCs of infrastructure that we deserve around this pandemic. We don't have 2 years into this pandemic. We don't have a national testing infrastructure. We don't have a national tracing infrastructure. We don't have national policies around isolation and lockdowns when uncontrolled spread happens, when these surges happen. This pandemic will move from being something that can be addressed in these sort of like in these sort of ways to one that's more endemic. But we need to use this opportunity to absolutely go full throttle in a fundamental restructuring of our healthcare system. I mean, Medicare for all has unfortunately dropped off the national agenda. We need to reinsert it into the national agenda. We need to reinsert it in the agenda organizing in New York State, because we have a Medicare for All bill in New York State. So those things, they've been, these structural questions have been sidelined. They've been deprioritized, in particular with healthcare, which is a very bizarre thing for me to go through a pandemic, and within the left even not having Medicare for All be front and center with some of the efforts that we're organizing. And then at a more concrete level, I would say obviously coming out and building support for local campaigns of healthcare workers that are pushing for these things is important. I mean, nurses knowing, healthcare workers knowing, hospital workers knowing that there is community support, there is support in political entities for their fights is very heartening.
Mm-hmm.
And that we have a lot of these, new politicians. I mean, mainstream politicians are not dumb. They know that the political winds have shifted, and so they're talking a lot more progressive. They're saying a lot of the right things. Mayor Adams is very smart. He can say a lot of the right things, and seem very like he's on top of things, and that he's kind of got this. But I think we need help in challenging politicians to put the money where their mouth is, and to get underneath the bluster, to get underneath the promises, and get at the heart of what they're not doing. Because what all of them are mostly unwilling to do is talk about the fundamentally restructuring some of these key elements of our political system and our economic system. And I think that healthcare is one of the institutions in our country that has most obviously failed the people of this country, and has and can be most directly organized around. And I think nurses and teachers, the way we're fighting back against these decisions that have been made over the last 2 years, I think we have been some of the most active in the union movement. We have been some of the most visible. We are connected to other workers' lives in terms of services that we provide. And I think that our struggles can have the impact of widening the scope of beyond just an individual hospital or individual school system. So, and I think it's especially important right now in this upcoming year. I mean, right now, states and city budgets are actually kind of flush. The federal government budgets are kind of flush with money. And we also, as hospital workers and as educators and really workers throughout the economy, have a lot of leverage right now because there's a labor shortage. And so our employers should be on the defensive right now. So it's really any fight at Amazon, any fight at Starbucks, any fight in any element of the economy, it can have a lot of power right now, because employers are so desperate for workers in order to turn their profits, in order to keep their systems functioning. So we have a lot of leverage right now, and this is the year we need to use it, because the next year we're going to see the return of austerity. They're already, if you look at the policies in the Federal Reserve, you see the quantitative tightening that's happening with interest rates. And there's going to be the drying up of any sort of stimulus money. The banks aren't going to, float the U.S. government any longer. And so there's going to be there's going to be a cliff that we fall off of in terms of these services if we don't fight for this fundamental redistribution of resources.
Yeah, I think it also plays into what you were talking about with this false normalcy argument, because we will hear people say we're back to normal. We don't need the stimulus money. We need people to get back to work. We don't need unemployment being higher, et cetera, et cetera, et cetera. And I think those two sides fighting against that false normalcy narrative and then getting out and joining people, supporting union efforts, making sure you're connected to the kinds of economic pressures workers are putting in your local community, all of that seems essential going forward.
If you like this video from The Jacobin Show, please hit like and subscribe and share with your friends. Thanks.